Hi, I'm Dr. Bliss Lewis. I'm a psychiatrist and an integrative medicine doctor. And let's talk about what are some non-medication natural strategies to help for subclinical hypothyroidism that might be affecting mental health. So we know that thyroid has a big influence on mental health. I covered that in other videos. Let's look at some of the details of what can you do that's not a medication, that's a lifestyle. First of all, including iodine-rich foods in your diet, in eating fish or seaweed, can help to support thyroid function. So many of us are short on iodine. You could take iodine supplements or you could just get iodine from food. Also, selenium is a nutrient which is supportive for the thyroid, and you can get it through eating Brazil nuts. That's probably the easiest way, and you don't have to eat like huge quantities. A couple Brazil nuts a day might be enough to provide selenium. Of course, this is also something that can be gotten from a supplement, but this is a food-based way to get it. Another thing to do is to take gluten out of your diet. So people who have subclinical thyroidism might be particularly sensitive to gluten. Maybe there's even the extreme form of celiac disease. That's something to screen for. So taking out gluten for a period of time and potentially like tracking symptoms and potentially reintroducing and retesting, you really want to figure out if gluten is contributing to your hypothyroidism. In general, most people who work in this area and work with the thyroid basically are like, there's definitely a good reason to take gluten out. Like if you really want to understand in depth how that works and why, I have some videos about that. There's also a book by Amy Myers that goes in great length and depth. If you really need convincing that it makes sense to try to take gluten out of your diet to see if that improves your thyroid function. Another nutritional strategy for helping your thyroid is to eat an anti-inflammatory diet and to include anti-inflammatory foods in your diet. So those are foods like turmeric, ginger, fish. You can also take supplements, but food is fundamental. And if you eat in a way that's anti-inflammatory, that will support your thyroid health. So overall, an anti-inflammatory diet, anti-inflammatory lifestyle will help your thyroid and potentially help you recover without the need for medication from subclinical hypothyroidism. Another thing that affects the thyroid is stress, right? And there's a lot of stress in our lives. So something you can do is look at your life and assess the stress levels and also introduce stress management techniques that work for you and build them into your life, right? And sometimes that might be like, give it a 3-month program, right? Like implement lifestyle changes, nutritional changes, relaxation, right? Improve sleep. And see, right, recheck your thyroid levels and see if things get better. I've noticed with my patients when they improve their lifestyle, suddenly their thyroid works better. With sleep specifically also, like you want to have enough sleep for you. Sleep is definitely essential for hormone health and for thyroid health. So somewhere between 7 and 9 hours of sleep per night, good quality sleep, restorative sleep, that's what's recommended. Exercise can also help to support thyroid health. So exercise is very anti-inflammatory, and whether it's aerobic exercise or strength exercise, whatever works for you, you will reduce inflammation and you will help your thyroid through that. Another important thing to consider is the health of your intestinal lining and your gut, right? And also the health of your microbiome. Right? So avoiding things that could be harmful, whether foods, medications, and also feeding your microbiome things that your microbiome wants, right? Probiotic foods, fiber-rich foods, prebiotics, having fermented foods in your diet, all of that will support gut health. And of course, avoiding things your gut doesn't like, that are highly processed or gluten or whatever else you're sensitive to. A more complicated thing is that environmental toxins, pesticides, heavy metals, all of that can affect thyroid function. Our thyroid is very sensitive to what's around. It's one of those organs that's like, kind of telling us that we live in a contaminated world. And we have no idea what exactly in the environment is messing with our thyroid glands. There are some suspicions, right, that there are various things, chemicals in all kinds of products in the water also that interfere with our hormones. I'll have a whole separate video about that. And doing whatever you can to minimize your exposure to those chemicals, right? So that might be just like keeping a clean house, wearing more natural fabrics, avoiding artificial dyes in your clothing, avoiding additives and chemicals in your food, filtering water, filtering air, doing what you can, right? Of course, there's no way to avoid all the exposure to chemicals, but we do what we can. Another thing you can do is sauna, right? So, there are countries in Europe where people sauna 7 times a week, right? It's just something you do with like your evening routine. And that's also a way to get toxins out, right? So that's a way to detoxify, to protect everything, including the thyroid, from the impact of the accumulation of these toxins and chemicals in our bodies. It's also important to have help, a medical professional who can help you monitor what's going on with your thyroid, who can run labs and compare them over time so that you can figure out if this or that lifestyle change or the combination of the lifestyle changes is working. And also to track, and if you hit a low enough level of thyroid function, then you may need a different intervention, right? So you don't want to miss that. So it's important to have a clinician and to do regular tracking and monitoring. It's important to have a clinician and to track your thyroid hormone levels through blood work to know what's going on. So in this video, I shared with you 10 strategies that are a great starting point to take care of your thyroid health naturally without going to needing medications. So these strategies, they will help you protect your thyroid to stay well, and they can help for subclinical hypothyroidism where medications are not yet indicated, and you want to do what you can so that you don't progress that way, but you actually help your thyroid recover. And that is totally doable and possible with lifestyle interventions and detoxification. Some people will progress to full-blown hypothyroidism and may need medications, but try implement as many of these strategies as you can to protect your thyroid. And I've seen many patients who were in this place of subclinical hypothyroidism who then normalized their thyroid function. So hard to say what exactly. Was it just time? Was it something they did? Was it taking gluten out? We don't know exactly, but great, right? If it was abnormal and now it's normal, great. And if you have, just even barely hypothyroid, low thyroid, but you have symptoms, even some metabolic symptoms or foggy thinking or, anything that mild depression, like it's worthwhile to implement all these lifestyle strategies to help your body recover naturally.